Okay, this is video number 4 for chronic diseases. Here I am saying what foods to eat, and there they are, right? All those foods. This is in the letricides with the low glycemic index that don't spike your blood sugar. So let's talk about heart disease. Heart disease it's more complicated. It's simple, but it's more complicated than you think it is. So when you talk about heart disease, you're actually talking about a disease of the arteries, right? Arteriosclerosis. Now that has that connotation that your arteries are becoming stiff and old and hard. That's not exactly true, but it's good enough. Things that we know contribute to this process of your arteries getting old and sick, aging. I mean, certainly. I just told you having diabetes is one of the reasons. Hypertension. Having high blood pressure for many years just puts your arteries under a lot of stress all the time, and they sort of age, if you will. Eventually, if you end up having heart disease, what doctors are looking for are things called plaques. A plaque is kind of a growth on the wall of the artery. It doesn't always have to stick in. Sometimes it actually bulges out towards the body, not in towards the middle. And if you look inside those, you find LDL, the bad cholesterol. That's why we call it the bad cholesterol. You might find a little HDL, but it's mostly LDL. Ergo, we call it bad cholesterol. You also find white blood cells, and that's the important part. It's not just that your cholesterol levels are high and cause these plaques to develop over many decades. Your immune system will identify that these plaques are forming. White blood cells will show up. Unfortunately, they go into the plaque after the LDL, eat the LDL, get caught, and then recruit more white blood cells. So it's not just your bad cholesterol that causes heart disease. It's also your own immune system. And then eventually what happens, these plaques get big enough. They don't really clog the arteries. They explode. They rupture. The little cap of the little plaque kind of blows open. See if I have any. Here we go. Here's your artery. Here's the plaque that formed. Here's a blown plaque. This is an artery. And all this stuff kind of shot out and caused a blood clot. That's really 70% of all heart attacks are a blood clot, kind of a ruptured plaque, if you will. And what's blowing out of there? Old LDL, old white blood cells, and a lot of junk that gets caught over there for the decades. Here's another good example, right? And there's our white blood cells in there, there's our cholesterol in there, and all that debris comes out and causes a clot. So, and that clot can form what's called a thrombus. And the scary part is the thrombus, that blood clot, by the way, can also leave the heart area. So you can have a ruptured clot, this little plaque on the side of the artery, blows open, clots that artery, so whatever's downstream doesn't get enough oxygen and glucose, and part of the heart can die. Then that clot can actually dislodge and travel up to your brain and cause a brain clot, a stroke. When patients have heart attacks, their primary goal is obviously to stabilize the patient, but also to dissolve the plaque, so you don't have any downstream clotting issues that occur in another part of the body. LDL is the brick. That's what's in there, okay? And so when we want you to have desirable LDL levels, so if you have a lot of bricks, LDLs, floating around for 30, 40 years, the likelihood that you're going to have plaques in the arteries, these little deposits, will obviously go up. So we like to see your LDL as low as possible. And then HDL, for whatever reason, having high HDL, it doesn't really clean the plaques, but it helps your body resist the process by which you develop plaques. The higher the LDL, the better. And I'm just going to focus on that for our class. You want lower LDL and higher HDL. If I said that wrong, I apologize. And that's your goal. Now, some of that you can do with diet and exercise. Some of that's going to be genetic. Your LDL and HDL will be genetically determined. Women have higher HDL than men. Prior to menopause, the presence of estrogen in a woman's body positively raises her HDL. A woman's HDL should be about 50. A male, it's about 40. And so males do make estrogen, but it's not the male sex hormone. So they don't get the benefit of having the same amount that women do. Now here's something you may not have heard, and I think this might be the end of this first video. When they measure your bad cholesterol, what they're actually sort of measuring is a volume. The volume of LDL in, let's say, an amount of blood. They take out, you go in for a fasting blood draw, they take a tube, they take a needle, they extract some blood, and then they spin it down, and then in a certain amount of blood, they're looking for your LDL. The problem is, that is a volume, it's an amount. Milligram per deciliter is the same as milliliter per deciliter. It really, just believe me, it is. What they typically don't measure is the size of your LDL. LDL actually can come in kind of two different sizes. Big ones, again, bad cholesterol. Big ones, which aren't as bad, and little ones, which are badder or worse. And if you think of it this way, what can burrow in, and I hate to use this term, but it's not correct, but it's fine. What can burrow into your artery walls? Smaller things versus bigger things. Chylomicrons are loaded in fat and cholesterol coming from the artery. No one has ever said you're coming from the small intestine. No one has ever said chylomicrons cause heart disease. They're just too big. They can't possibly get underneath your artery wall or the cells in your arteries to burrow underneath this one layer of cells that lines your artery wall. LDL can do it, and small LDL can more easily do it. The problem is when you measure your bad cholesterol at a traditional hospital setting, they don't ask how many are there. They just ask the total volume. And it could very well be your LDL is 100. That's great, and your doctor will be happy. What she doesn't know is you don't have big ones, you have little ones, and they're more likely to cause a problem.